Good morning, I'm Paul Graham. Welcome to another edition of Talk to the Experts. Good friend, Dr. Cindy Nagel, back in the studio, Horizon Dental Clinic. Can you believe 2 months of this year have gone already?
No, I don't know where January and February went.
Isn't that incredible? It really is. Before we got going here this morning, we were talking off air, Cindy, and you were talking to me about HPV. First of all, what is that?
The human papilloma virus.
Well, I'm glad you were the one to say that.
Oh, yeah, it's my job.
Yeah. Now, there's apparently this virus is more or less paying attention to young girls, right?
Yes, because it causes over 70% of cervical cancers. When they first started looking at vaccination programs and protocols, they were really targeting women and young girls especially in order to prevent these sorts of cancers.
Now, there's a new vaccine for boys.
Yeah, well, what they've done is they've decided to expand the vaccination program. So what they were doing before was offering it, I think, in the 6th grade for girls. And they were also offering it for women or at-risk men between the ages of 9 and 26, I think. So it depended on sort of what you qualified for, what they thought was, best in your interest there. But because of the rises of other cancers, not just cervical cancer, now they finally, in BC, agreed to add boys to the vaccination protocol. So now boys in the 6th grade will also get that protection.
So they found other things that this can work for then.
Oh, yeah. That virus is responsible for a lot of different cancers.
Wow.
Yeah, it's gained a lot of, awareness in the last probably decade or so. But it's interesting how many different sort of like varieties of symptoms or different things it can cause. Like even sometimes I see little warts in the mouth. Things like that.
I was just going to say,
weird.
Cindy, here you are, you're a dentist, and you're telling me about
about
this
cervical
vaccine.
cancer.
Yeah, exactly. I should be talking to a medical doctor, but
right?
It goes much further than that.
Well, yeah, because it does. It actually causes over, I think, what did I write down there? 80% of oral cancers. So this is cancers of the throat, of the head and neck. There's all kinds of different ones that we screen for. HPV-related oral cancer is actually really difficult to diagnose because it's usually not something that we find until you end up with a swelling in your neck.
Whoa.
Because a lot of the time it's in your throat. And I mean, even I can't see that far down there. I mean, I know sometimes it feels like I'm reaching down your throat, but it really not going that far. Yeah. So that's the only time we pick it up is when all of a sudden you have a swelling in your neck and it's like, oh, that wasn't there before. And at that point, it's already, at a further stage of cancer at that point. So it's a little more challenging to treat. You've got radiation, chemo, surgery. It's treatable, but because we're not catching it very early, the death toll, unfortunately, is still pretty high.
Are there tests available to check for this before you can actually see the red spots or whatever?
For the throat, not so much. It's not something that they, as far as I know, anyway, screen for. I certainly don't swab people or look for things like that because you're right, we don't really have
there's no blood test or anything that can be done for it.
When it gets to a certain point, we can test for certain types of cancer markers and things like that, but you're still going to be at that stage where you're seeing your doctor because there's a swelling or because there's a problem like that. Yeah. So it's not like with cervical cancers where we'll screen for that using swabs and different stuff, or, if there's a wart, like I said, in the mouth that I can see, I can take that off. And I can get rid of that before it becomes a problem. That's right. I will just laser that sucker off. I will kill it and it'll be gone. It's awesome. But, if we can't see it, then we can't treat it. Right. So really the burden became that of prevention. How can we stop these cancers from starting? Because if we can't catch them once they've started, then it becomes a lot worse for patients later.
How prevalent is the HPV?
A lot of people carry it.
Really?
I do not know the
I've
actual
never heard
numbers.
Of this before.
Really? Oh my gosh! I guess it's I'm a doctor, right? I'm a doctor. I know all these things. I remember learning most of it in high school biology. Just learning about the different viruses.
And your experience in that Calgary hospital as well.
Well, yeah, I saw so much cancer in Calgary, and most of the oral cancers that we saw and we treated were HPV related.
Really?
So when you think about that, a simple vaccine when you're 9 years old can save you from 80% of those cancers. Potentially, that's a huge difference. And the fact that boys are going to be protected from this now too is just the BCDA and all of the dentists out there that want to be on top of these cancers. We're really excited.
Well, yeah, prevention's everything, right? And it really puts the importance on come on in and get that checkup because you never know what you're going to find.
Exactly. I mean, you think about all the little things that you can't see in your mouth and all the different problems that can happen if things aren't caught. Like I said, if I see a small wart there, I can take that off no problem, and it's not going to be there anymore. The virus will be gone, at least from that location. But that doesn't mean that you can't get it again, that it can't resurface. So these things need to be followed up.
I'm curious. I've never heard of the wart in the mouth thing. This is all brand new stuff for me.
Yes.
The HPV and the wart in the mouth. Would you send that wart out once you remove it for a biopsy?
Sometimes. It depends on what it looks like and how big it is.
Okay.
There are some of them that look kind of like plantar warts, actually. And so they're kind of flat little balls. Those ones I just destroy with the laser.
Okay.
Because the biopsy itself...
you play the Star Wars theme in the background?
Yeah, more or less,
okay.
yeah. The biopsy itself is usually a little more painful just because you have to take so much tissue with it.
Okay.
And something that looks like a plantar wart isn't really something that I feel is necessary to biopsy because it's not cancer. It's a mark. It's a wart. But it could become cancer later. If it's something else, if it's ulcerated or I don't know what it is, or some of them look sort of like, it's kind of hard to describe, but white hairs.
Okay.
Coming off of your cheek or something. Like there's all kinds of weird stuff out there.
Yeah.
That stuff I will absolutely biopsy. I will send to the pathology department at the hospital, and they'll tell me within a few days whether or not this is something that needs to be worried about. And 9 times out of 10, it comes back as, either it's benign and it's not a big deal, or yes, this could have become cancer at some point, but congratulations, you took it off, so everything's good.
Now, is there a demographic for all this stuff? Like it's more in kids than it is in adults, or is it just any age group?
This sort of thing takes its time to develop. So for the most part, like especially with these oral cancers, most of the people that we were treating in Calgary were in their 50s.
Really?
Yeah. So
Okay.
still pretty young, but definitely not children. Unless you have a child who has like an immune disease or an immune cancer, they're not going to manifest those kinds of viruses very quickly. Their body's able to kind of fight that stuff off, and they're not really exposed to it. So it's really something that, again, it takes time to build up, and we usually see it, average age is about 50.
Well, the reason why I asked if it was in children, you've got to talk to the parents as well.
Oh, yeah. It's all about education.
Yeah. And that's the idea, again, to pick up on these kinds of things, stuff you don't really hear a lot about.
Yeah.
The main thing is to get in to see a dentist on a regular basis, not only for the cleaning and but to get a checkup, as it were.
Screen for soft tissue disease, screen for cancers at any age.
How come we're all of a sudden hearing about this kind of stuff? I mean, 50 years ago, I drank out of the garden hose and I still managed to make it through to now.
Well, I did too. I don't know if the garden hose is necessarily a seed for cancer, but I think one of the things is how easy it is to get information these days, right? Even when I was, a kid, I don't think we had a computer until I was 15. And I think we were kind of late to the game on that, to have a household computer. We didn't have internet until I was going to university and I needed it.
Yeah.
So now that everybody's got a smartphone and the internet's everywhere, Wi-Fi's everywhere, information's everywhere. So
Right.
you're hearing more about these different things. Like
They were always there before, but nobody knew anything about them.
And then there's also just differences in terms of, lifestyle, stuff like that. People are living longer, so we're seeing more diseases or different kinds of diseases. There's different sorts of lifestyle changes as well. Our diet is not as good as it once was.
Yeah, I guess
In
so,
general, our diet is kind of crummy.
Yeah.
So we're seeing a lot of these things kind of spring up with that. But a lot of it, too, is just how good our medical system has gotten at looking at things and trying to find answers to things. People have, there's cases of cancer and diseases dating back hundreds and probably thousands of years. But when the people passed away, it's not like we did autopsies and we're like, oh, this person died of liver cancer. Like if you passed away, you passed away.
Yeah.
Right? So it's just such a different climate in terms of how we think about disease.
Wow. Dr. Cindy Nagel of Horizon Dental Clinic in the studio talking about a variety of different things. I've got to take a break right now. When we come back, can you and I talk about braces and dental x-rays? We have never talked about that. Can we do that?
Yeah, I'd love to.
And that's what we'll do when we come back to Talk to the Experts on Radio NL. Welcome back to Talk to the Experts. Oh, yeah, you're not Dr. Cindy Nagel anymore. I forgot about the last time. Dentist Nagel.
I was going to ask you about that before. It's like, whatever happened to Dentist Cindy?
Yeah, Dentist Cindy. Cindy Nagel, of course, with Horizon Dental Clinic out there in Brock. We were teasing the folks, Cindy, that we're going to talk about braces and dental x-rays. Let's start with the x-rays. To me, with technology the way it is today, I thought that was antiquated already and it doesn't exist anymore.
Oh, wishful thinking. I still need to see what's going on under the surface of the teeth, believe me. Can't quite get away from the x-rays yet, but the technology has come a really long way from the film stuff that we used to use. For the first thing, like most of the time when I have people that are worried about x-rays or concerned, they're always really nervous about the radiation. You know, because radiation causes cancer or it causes
one time
this or
microwave
that.
ovens did the very same thing. You couldn't walk by it when it was on.
Yeah, exactly, right? So thankfully the tech's gotten better, and if we have digital x-rays, so, you know, with the sensors, the ones that go on the computer instead of, you know, on the film in your hand that look like a negative, it's 70% less radiation now that we're doing it that way.
So that eliminates the lead apron?
Yeah, actually, technically speaking, we don't need the lead apron anymore, but we still use it because people feel more comfortable with it.
How heavy is that thing?
It's not that bad, actually. It's a couple of pounds.
Oh, okay.
It's like maybe 5 pounds or something. It actually feels kind of nice. It's like having a weighted blanket.
You know, I was in the Vernon Hospital about a month and a half ago in the emergency department. It wasn't for me. It was for another situation, and saw a couple of x-ray technicians, a couple of young people getting ready to do x-rays on a little youngster, but they were dressed head to foot in this lead costume, if you will. And
I've worn those.
Yeah, I guess they pretty much have to. I don't know.
It's because, well, you know, again, dental x-rays are a little bit different than the hospital grade ones. So the hospital grade stuff uses a bit more radiation because they're trying to get through a lot more dense tissue. Like if they're going for something in your chest, let's say, there's ribs and muscles and heart and lungs and all these other things. I just need to go through your teeth and your cheek. So it's not so bad. But when you're a technician, you got to think about how often you're taking x-rays. Like if
I never thought of that. That's
you're
right.
in there for, what's your shift? 8 hours minimum. If you work in a hospital, it's probably closer to 12. I don't know. But if you're taking x-rays for, 8 hours a day, the radiation that you're going to receive is going to be every single time you take one. And they'll probably take several dozen in a day, I'm assuming. So, whereas the patient gets one dose, the techs will risk a lot more.
What happens to these techs if they do get over-irradiated, if you will?
Well, we do measure for it. Even in the dental office, we wear these little tags called dosimeters, and they basically absorb radiation around you. And then we send them in to the government for testing, and then the government tells us if we've received too much radiation. And then we have to go through some sort of treatment, I'm assuming. But thankfully, this never happens in the dental office. In hospitals and stuff, I mean, the biggest potential complication that most people quote when they're talking about radiation is becoming sterilized, so not being able to have children, that sort of thing.
Oh, okay.
It affects those organs very easily.
Yeah.
But there's also certain cancers that can be affected by radiation or encouraged by radiation, and a thyroid disease as well. Like your thyroid is very susceptible to radiation, so that's why they have the big thyroid collar, and you try and cover yourself up as much as possible. But I think I've never read about an actual case of a technician getting a disease since we started these protocols.
They've got to be very careful. I'm sure they know all the different angles and the preventative measures they have to take.
Oh, yeah. And there's lots of barriers, too. Like in the hospital, there's lead barriers you can stand behind. In the dental clinic, we have, like all of our cabinetry and stuff stops radiation, different things like that. The radiation can only go so far as well. Like in the dental clinic, the beam can only go about, I think, 4 feet or something, and then there's nothing left.
Okay.
So all of our operatories are a good 6 feet apart. So you can't really get anywhere. And if the beam is pointing straight at you and the technician is standing behind the person, then they're not going to get any scatter radiation because our technology's gotten to the point where it doesn't do that.
Another tool that doctors use, the medical doctors use, is the ultrasound. Do you use that as well?
It doesn't really have much of an application for what we do as dentists, although
ultrasound is for like moving X-ray, I guess. Good way to explain it.
Exactly. You want to visualize something like that. It's good for finding blood vessels. It's good for finding the heart, for visualizing inside cavities of the body, things like that. I'd have to think about an actual application for dental, but we don't do that much with large tissue spaces. So needing to visualize them isn't really as important for what I do.
So it's not a big deal. It's just nothing hurts.
No, you get more radiation. Like the maximum number of X-rays that I would take on a person is 16 small like intraoral X-rays and 1 large panoramic X-ray that's going to go, and encompass the whole head and the jaws. We could do all of that on you, Paul. And if you took a plane from here to Vancouver, you get more radiation on the plane.
Really?
Absolutely.
All right.
Yeah. If I take a couple of screening X-rays on you, the little bite wings that we look for cavities with, you would have less radiation than walking downtown for the afternoon. Solar radiation is radiation. So when you think about it like that, I mean, you'd have to have something ridiculous like 500 dental X-rays to get the equivalent of a chest X-ray for your heart in the hospital.
Wow.
So the stuff that I'm using, especially now that it's digital and there's 70% less radiation and the scatter's contained and the quality of the image is so much better. It's really, there's nothing to be afraid of when it comes to X-rays.
Do dentists still use film? Are there dentists out there still using film?
Yeah, there's still offices that have been around for, a long time, since the 70s or 80s when we didn't really have digital X-rays. And unless they upgrade the tech, which can be a little pricey and sometimes unnecessary if your equipment is still functioning well and you're still doing a good job with your film, then there's going to be lots of places that might still have it. Definitely, though, like thinking of myself as a startup, as a new office, I don't even think I could buy equipment for film. I think it would have to be specially ordered. And there wouldn't be any point to it because there's just so many pluses to the digital stuff. I mean,
how often do you do the X-ray thing?
Well, every new patient gets a certain number of X-rays depending on what they need.
Okay.
I don't ask for like a blanket number of X-rays for every patient because some people don't need as many. It depends on how many cavities I see in there. If you've had a root canal in your past, I'm going to want a close-up of that. If you have a crown, I'm going to want a close-up of that. So it depends on what's in your mouth. And then I tailor it from there. Most all of our new patients will get the big panoramic X-ray because I want to see the tissues, the jaw joints, and get kind of a general idea of what their teeth look like.
You get to frame it and then they get to take it home or what?
They can. Oh, absolutely. We can print that sucker off, no problem.
There you
I
go.
actually did that for a patient a few weeks ago because you can see some of the sinuses in the nose and you can see the palate and everything on these X-rays. And his had this perfect shadow of a pit bull face. And he saw that right away. He zoomed right in on that. He's like, "There's a pit bull in my face," and I was like, "I'm sorry, what?" And he was right. It looked really cool. It's like when you see shapes in the clouds.
That's weird.
Yeah, it was great.
Okay, I just want to get a couple of comments if I could. We'll switch from X-rays to braces. When I first met you, you had braces on.
That I did.
Yeah.
Whole year of it.
And I can just imagine, with maintenance. We've talked a little bit about braces in the past.
Oh, yeah.
Do you do braces yourself?
I do select cases, and I don't do full metal mouth as, people like to think of it. I do Invisalign with the clear trays, so it's a lot easier to clean. It's a lot easier for me to plan because it's all done digitally. But I only take on, simple cases, more or less.
It's a very specialized area then.
It is, yeah. Well, you have to understand a lot about the anatomy of the jaws, where the teeth should be, how far you can move them, different types of physics, torques. There's so many different types of tools that go along with it too, mini implants and retainers and appliances, and the list goes on and on and on. So for, complex cases or with children who are going to grow and change on me, and they're not going to stay the same, then I really enjoy working with my orthodontists because they know what they're doing. I don't want to guess. I don't want to feel like I'm not able to give the same quality as the orthodontist.
Right.
So, unless I'm confident that I can do the same quality, I will refer.
What are braces used for? It's a stupid question, I know, and
No.
I really don't know the answer.
To move teeth.
To move teeth.
To move teeth.
Yeah?
Yep, that's all it is. If you have too many teeth to fit your jaw, if your teeth are too small for your jaw and there's big spaces, if you've lost teeth and they've shifted and now they're tilted and they're in the wrong place, if your teeth don't fit together well and you can't chew, if your teeth are all over the place and you don't like smiling, if your teeth are wearing down really, really fast because they're too close together and you're, going to break them off if you don't move them to a better spot. There's so many different reasons for it.
And what about the hygiene of braces? To me,
Tricky.
I've never, pardon me?
Tricky.
Tricky, yeah. I've never had braces. I don't think I've ever been associated with anyone who's had braces other than meeting you and that kind of thing. But I can just imagine the hygiene part of it, keeping it all clean.
Yeah, trying to get the food out from between your braces is not fun, but there's lots of little picks and things like that. Sure, you have to thread your floss, and it takes a little bit more time, but you get, as long as you do it for about a week, you're pretty well practiced after that, and I could get it done within a minute or two. Tops.
And how long do braces stay on?
Depends on where you're at, how much movement you need. The average time is about 2 years for most people.
Okay.
You can't move the teeth. Sometimes you can't move them very fast, because if you move them too fast, then sometimes they'll shorten or things will loosen up too much, or you'll have other problems. And then, heaven forbid, worst case scenario, you can lose teeth if you try and push them too far too fast.
And these is tightening those wires, I guess. That's what happens.
Tightening and adjusting, torquing, all kinds of fun stuff.
Talking with Cindy Nagel, Dr. Cindy Nagel from Horizon Dental Clinic. Interesting conversation today. We'll pick this up when we come back on Talk to the Experts on Radio NL. Welcome back to this edition of Talk to the Experts. Dr. Cindy Nagel, Dentist Cindy, we call her now, from Horizon Dental Clinic in the studio. And we got going here for the first 20 minutes, Cindy, and we got really getting in depth with a lot of the different topics. And I still have a long list of stuff I'd like to talk to you about.
Time flies when you're having fun.
There you go. There's a national program out there right now. It's called Smiles for Canada. What's that all about?
Yeah, I wanted to talk about this because it's really cool. That's one of the reasons why, we were sort of inspired to talk about braces, because Smiles for Canada is a program that I believe started in Ontario. They've just launched it here in BC. And what they're doing is funding full orthodontics for kids under 14, or for eligible kids under 14. So, if you're in a situation where you're low income, or the family is on disability, or a child with a disability, or, special needs, if you apply for this program, you can have the full braces covered. And I know that for most kids, braces are probably going to cost parents around $8,000.
Wow.
It's a lot of money.
Yeah.
And it can be a lot of years, and it can be a lot of different therapies. So the fact that they're trying to fund this just blows my mind.
Yeah, it's, how is it funded? How is the program funded, first of all?
It's the name of the charity is Smiles for Canada.
Yeah.
And they're working through...
Is it government money that goes into this?
I think there's some government money, but a lot of it seems to be coming from, I think it started from the Ontario Dental Association.
Okay.
There's a specific group of orthodontists that started this as well. And I think that they were just probably, kind of like some of the other medical professionals out there like myself that, get fed up with how many people we have to turn away because of the cost. And
I know you long enough where that bothers you.
It does.
Because we're talking about the health of a person.
Exactly. I don't want somebody to come in and feel like or avoid coming in because they feel like they can't pay for something.
Yeah.
It just drives me crazy. And it's hard because I would love to give away all my services. I really would. If I could do this for free, I would. If my overhead wasn't so high, I would probably have such a different way of doing things. But it is a business.
Yeah.
So we can't give everything away as much as we want to. And it's challenging to sort of wrap your head around it. So when something like this happens where all of a sudden there's funding available, especially for something that for a long time was considered to be elective, right? Like not necessary. Most people still think about braces as something you get because you want a pretty smile. But for some people, especially some kids, it can be about functioning as well. I mean, there's lots of people, Angus was one of them, my husband, where he had very, very bad mouth pain for years and years and years, where he could barely chew because his teeth were all in the wrong spot.
Wow.
And you see him now, his teeth are gorgeous. He's got just this Hollywood smile. He's got big, bright teeth, and everything's nice and straight. And he had to pay something like $15,000 in braces and like 3 years to get there. And he couldn't do that until he was in his 20s, because that's when he started working and he had money of his own.
Yeah.
And he was able to prioritize that for himself. And he was lucky that he had a good enough job where he was able to put the money into it.
Has
So,
to hurt you
yeah.
in a way that a child comes into your clinic, and you're thinking to yourself, boy, where were you a year ago? We could have done so much for you.
Oh, yeah.
And then you have to talk to the parent, of course.
Yeah.
And the parent would say, probably, well, we just couldn't afford it.
Yeah, or we only just got dental insurance, or there's
Yeah.
only just something like this. I hear that a lot, and I get it. I really do. I know what it's like to, have a family struggle and to not be able to put your money into stuff like that. Dentistry is expensive. Like
Yeah.
we cannot deny that. And it does hurt my soul a little bit when I
Yeah.
see these sorts of situations. But at the same time, I'm so grateful that they've finally come. Sure, if they'd been there a year ago, maybe things would be different. But if you're here now, let's just worry about what we're going to do next and not worry about what might have been.
Yeah. You mentioned the criteria. How do folks find out about that criteria?
I would Google the Smiles for Canada to start with. There's some eligibility criteria on their website. If also you could look up the orthodontists in town here, Carrie Flintoff, Dan DeGasso, Rick Odegaard. They are most likely going to be a little more informed about this than I am, because
Okay.
they do all of this stuff. But yeah, or you can ask your dentist, or you can ask me about it, and we'll try and hook you up with the information to kind of move forward from there. But there's lots of people in town here, lots of general dentists like myself that also do braces. So if you're one of these people who, like I said, is on the lower income side, child has a disability, or you think that you might even somewhat remotely qualify for the criteria, ask your dentist about this program, and we will all do what we can to get you through it.
It's called Smiles for Canada program. That sounds great.
Yeah.
Spring break coming up pretty soon.
I know.
You should be busy.
Well, we still have lots of openings, actually.
Oh, okay.
Yeah, because it's 2 whole weeks for spring break, although I hear they're cutting it down to 1 next year.
Yeah, well,
Ooh.
that's what they're saying.
Yeah, I don't know if everybody's going to go for that. But spring break is a really great time to be in the dental clinic, because you don't have to worry about pulling your kids out of school, and there's going to be a lot of parents as well who are off work or have a little bit of extra time. So by all means, if you're interested in getting your teeth cleaned, have some fillings to do, you want to finally take that step and book your new patient exam, we do have some openings for spring break, and it would be really great to have you in.
So you'd be like a babysitter for a couple hours, right?
Oh, definitely. We've got the bear out the front. Everybody
that
is
great big bear,
dogpiling on
yeah.
my bear. We've got all the toys and the games and the books and the TVs and the, we've got lots to entertain kids, so for sure. Drop them off, go have a coffee at the Tim Hortons down the street, and come on back.
Okay, so that's good advice. Spring break offers the opportunity where, like you suggested, you don't have to get them out of school.
Exactly.
Just a simple checkup or whatever.
Yeah, exactly. Or if there's treatment that needs doing, and again, you didn't want to pull them out of school, perfect time, spring break.
Next week, March 12th through at TRU, what's that all about?
We are going to be doing an event called Teen Fest.
We being?
Well, me as in, Horizon Dental. Teen Fest is actually sponsored by, itself, Teen Fest is actually sort of, I guess, festival that happens in multiple different places across Canada. I think it started in Calgary, but there's places all over the place that'll do it, and it's sponsored by a couple of big names. I think there's a couple of banks in there and a few other different national sponsors.
Yeah.
But it's basically going to be the type of thing where we all have booths, sort of like Overlander Days on the North Shore in the summer. And, it'll give people a chance to, test out different things. So, I know for us, we're going to have some games, some fun stuff for people to play, and a chance to win a Sonicare electric toothbrush. So that's always a good reason to stop by the booth. We're also going to have some information. So if people are curious about any of the services that we provide or just have general dentistry questions, that they want to ask, I'll be there all day. So that's going to be a lot of fun. And there's going to be lots of other booths. There's different categories. We're in health and wellness, but I think there's a bunch of other ones. There's going to be some nutrition stuff there. So lots of food. There should be some stuff about sports. And I think they're doing a few things about education as well, sort of trying to get everybody thinking about all these different things. And it sounds like it's going to be a lot of fun. So I'm looking forward to it.
So, it gives people a good chance to meet you. They've been listening to you for over a year and a half. And
if you're listening, come say hi.
Dennis Cindy over there. It's a week today at TRU. Whereabouts at TRU, do you know?
Actually, I don't remember.
Okay.
I'm terrible. Angus did all the details. This is what happens when you have such a great office manager. But I am assuming that it's going to be in one of it might be in the gym, like the indoor track.
Okay, hillside.
Thank you, because it's a big space there.
Right.
So that's where I'm assuming, but to be honest, just Google Teen Fest and they'll tell you from there.
That'll be on the TRU website then, I guess, eh?
I think so, yes.
Yeah, tru.ca Teen Fest. That sounds like it's going to be a lot of fun.
I think it will be fun.
Well, I know you love Overlander Days.
Oh, gosh, yeah. Overlander Days is the best. I got to figure out a way to get myself into that dunking tank. I feel like I'll get a really good response if I go in the dunking tank. It's like Dunk the Dentist.
There you go.
I got to talk to Steve Puhalo at the North Shore Business Improvement Association there and see what I got to do to get me in that dunk tank.
I'll see if I can pull some strings for you.
Right. Well, it's so hot at Overlander Days, too.
Yeah.
So the idea of being in the dunk tank just appeals to me. So, yeah.
Oh, there you
It'll be
go.
fun.
Cindy, it's been a pleasure once again to speak with you. We covered a lot of area today, and I look forward to our next conversation.
Oh, me too. I know. It'll be great. I'll just be coming back from continuing education in Arizona, so
wow,
this will be fun.
How do people get a hold of you?
Best place to find us is our website, horizondental.clinic, or phone the office at 778-765-3928. And we're located in Brock, on Tranquille, just past the Brock Shopping Center.
Right across.
Exactly.
Yeah, drop in, have a cup of coffee.
Yes, please. We have good coffee, tea, juice, water.
Got any more cupcakes left?
Maybe a couple sitting in the back there. Cupcake Day was a good day. We raised lots of money for the BCSPCA.
Isn't that great?
Yeah.
Dr. Cindy Nagel from Horizon Dental Clinic in the studio, and she'll be back a month from now to, we'll continue the conversation.
Sounds good.
You have yourself a great day.
You too.
And that's it for this edition of Talk to the Experts, and you have yourself a great day.